Hi guys, welcome back to my channel. If you are new, you're most certainly welcome. So today in this video, I want to talk about this misconception that respiratory therapy is easier than nursing. Because if you're thinking about going into respiratory therapy just because you were rejected from nursing school or you did not pass the entrance exam to nursing school, and you're just thinking, well, I can just go do respiratory therapy because it's easy over there and they seem like they don't do anything anyway. Newsflash, you're sadly mistaken, because there's this idea that respiratory therapy, the program, is like a lot easier. It really isn't. It really isn't. It's just as hard and it's just as time consuming as nursing. So don't come into this thinking it's going to be like a walk in the park and you're just going to like walk through fields of flowers and roses and rainbows and just get your degree and start working, because you're going to have to work just as hard for your respiratory degree as you would for your nursing degree. So there's a lot of people who think that, okay, maybe because they were rejected from another health science program, they can just do respiratory therapy just because it seems easy. I'm not going to lie to you, I had that same idea. Not because I was rejected from nursing. Obviously, I never wanted to do nursing. I think I talked about that in a previous video. I never wanted to do nursing, but I did think the program was going to be easy. And I was sadly mistaken, because it is really not. It, it really isn't easy, but it did teach me like a lot of things like time management and scheduling and stuff like that. So honestly, to be completely honest with you guys, every healthcare profession is going to be hard. It's going to be time consuming. So no healthcare profession is easier than another healthcare profession. You're just going to have to put as much effort and as much of your time into any of them. That includes respiratory therapy as well. Because last semester, if I'm going to be completely honest with you guys, last semester I really did think, like, I thought about dropping out of the program because I was just stressed out. I was so stressed out. Last semester was just horrible, you guys. Like, you know that horror story that you don't want to talk about and you just like want to leave it in the past and like just forget about it? That's how I felt. That's how I feel about last semester. Like, I just want to leave it in 2017 and never talk about it. But I'm going to talk about it with you guys just to like give you an idea of how stressful the program can be, and not just get into this thinking like it's easier than nursing, so you're just going to do it and get your degree. Because last semester, like, I was so stressed out, and I don't like being stressed out because I believe it causes wrinkles, and I don't, I'm not here for wrinkles. I'm not here for wrinkles. So anything that stresses my life out, I try to like eliminate it from my life, because I don't have time to be just walking around stressed out and just like hating everybody. Like, I don't have time for that. So I was just thinking, I was like, okay, well, this is really stressful, this is really hard, and I don't like stress in my life, so I should just like maybe drop out of the program. And because like, I just want to know, you know, who came up with that schedule like last semester? Who came up with that? Because anyway, so I had several thoughts of like really withdrawing from the program, and then I sat down and I thought about it, like, if this is really what I want, I will work hard for it. Like, I'm not just going to give up. I've come this far for me not to give up. Like, I'm literally this close to graduating, so it was not going to make any sense for me to just like withdraw from the program and have to redo that semester all over again, because I don't see myself doing that. And number two, I talked to a lot of people in my class and they were feeling the same way as well. They were stressed out, they were burned out. Some people cried, and some people actually thought about crying, and some people were like mentally frustrated like I was, and physically frustrated like I was. So talk to other people, and that really helps. Like, talking to other people really helps. It really does. And because someone is actually always going through the same thing as You are. So don't just sit down and think like you're the only one going through the same thing. So I said all that to say this is going to happen in the nursing program as well. You're going to be stressed out. You're going to be burned out. You're going to want to cry. You're going to want to second guess yourself, thinking maybe I shouldn't be doing this. Maybe this isn't for me. But the moral of the story is, and what I'm trying to get across to you guys is, if it's something you really want, you're going to work hard for it. You're going to dedicate your time. You're going to dedicate your schedule, your life to it, and just like work around the hardship and all the hurdles and the struggles. So don't give up, and don't go into respiratory therapy thinking it's easier than nursing and you're just going to like not study and not like do anything and just pass your classes and get a degree. Because if that's what you're thinking, you're not going to make it to graduation. You really aren't. You're really not. Because once you start feeling stressed out and this is really not what you want to do, you're going to eventually give up and withdraw from the program. And I think the moral of the story is every healthcare profession is hard. Not even just healthcare. Any major in college is hard. If it's not something you want to do, you're going to give up. But if it's something you really want to do, you're not going to give up. You're going to work hard. You're going to do whatever it takes for you to pass those classes. And that's what I did. So the whole idea of respiratory therapy is easier than nursing. It really isn't. At the end of the day, we're all going to be working together in the hospital to, care for our patients, and there shouldn't really be a comparison with both majors and both professions because they both are equally as important to patient care. So I think that's it for this video, and I will talk to you guys in another video. And you guys, okay, before I go, I was feeling very Wakanda today, the whole Marvel Black Panther movie, and I was like, I'm going to just channel my inner Wakanda, my inner Lupita Nyong'o, because she's my big sister in my head. Hi, Lupita. But yeah, I was like, for the whole sake of Black History Month and the whole sake of the Black Panther movie, let me just do my usual African print and come to you today with this video talking about nursing and respiratory therapy. But with that being said, I will talk to you guys in another video. Bye guys. One more thing before I go, you guys, I created an Instagram, and I will leave the my account name somewhere around here, and you guys can follow me on Instagram. Like, I know I was the only one on earth that didn't have an Instagram, and I finally made one, you guys, and you can follow me on Instagram, and I will try my very best to be active on there, or you can add me on Snapchat. Either one, it doesn't matter. I'll try my best to be active on basically Instagram because I'm kind of on Snapchat. Yeah, I'm on Snapchat a little bit, but I'll try to be active on Instagram. And I will talk to you guys in another video. Bye guys.